This is Dr. Anna Maria Mihalcha. I'm the president of AM Medical LLC. Today I want to talk to you about relief from chronic pain with methylene blue. What is methylene blue? It is literally an ultraviolet blue looking dye that's been known to science for over 120 years. Low-dose methylene blue is very safe. There have been almost 6,000 human studies that are listed. Methylene blue has properties that are antiviral, antibacterial, antimalarial, and it is a precursor molecule to hydroxychloroquine. It has some remarkable properties within the cell. It increases cellular oxygen consumption by 70%. The more oxygen delivery we have to the cells, the greater the electrical properties as well as the metabolic property and the health of the cell is. And methylene blue alleviates mitochondrial dysfunction, which is one of the prime reasons of how we age and how all chronic diseases are mediated. So it gives electrons directly to the electron transport chain to make ATP. ATP is the energy currency of the cell. So it is able to bypass any problem in the mitochondria and initiate the production of energy. The more energy we can make in our cells, again, the more we can regenerate cellular function and increase health. It is 1,000 times more potent than other mitochondrial protectors known. It has renewable auto-oxidizing properties. What that means, so an antioxidant is a substance that can give electrons, just like methylene blue, or you would know about vitamins like vitamin C. It can have antioxidant properties, and it does so by giving electrons. Methylene blue can give off electrons and then be recycled to do it again. So this ability to continue to give electricity, to make energy in the cell where it bioaccumulates in the powerhouse of the cell, which is the mitochondria, is very special property. It reduces reactive oxygen species. So one of the ways that we are aging and that our cells and DNA is occurring injuries is through oxidative stress and the production of these reactive oxygen species. So methylene blue is able to bypass that and reduce it. So henceforth, this has anti-aging properties. It has substantial anti-cancer properties, especially in photodynamic therapy. It is neuroenhancing. Neurons love methylene blue, and there are fantastic studies that show reversal of Alzheimer's, dementia, Parkinson's disease, and treatment of other neurological conditions. It has antidepressant properties because it inhibits an enzyme called MAO, which makes it similar to a tricyclic antidepressant. This has significant mood elevating properties. So the property of methylene blue that we want to discuss today are its substantial effects for pain reduction. And I want to discuss the studies and the scientific literature and the reviews of methylene blue in the research that I've done in the literature. This first study I wish to discuss, which looks at methylene blue in the treatment of discogenic low back pain. That means people who have discs that are dysfunctional, or they have herniated discs that are pinching nerves and causing severe pain like sciatica. And in this study, the conclusion was that methylene blue did not work. It is very important to be able to look at scientific studies and analyze the data for oneself, because sometimes the conclusions that the investigators arrive at are limited, or they are driven by other intentions. So I want to explain to you why I think that the results in the study were quite significant. So there were 8 patients who got 1 injection, which was an epidural injection with methylene blue. 1 patient had a sustained response with improvement in function, meaning they were able to move better around and they had significant ongoing pain relief. 1 person had an 80% decrease in pain for 6 weeks. 1 person had a 30% decrease in pain. 1 person had complete relief of pain for 2 weeks. And 1 person had 5 months of pain relief with recurrence of pain after. 3 people had no improvement. The reason why I think that these results are still significant is because this was just 1 injection. These people would usually take high doses of opiates, have other interventions like physical therapy that are ongoing, and they may not be able to have substantial pain relief. The amount of patients that were studied were very small. 8 patients is not a good number to give scientific documentation of whether or not something works or not. I want to give in comparison that the number needed to treat, which is an important number in scientific literature. So ACE inhibitors are blood pressure medications that millions of people take, and the number needed to treat to prevent 1 cardiovascular death, which is an outcome, is between 70 and 124 patients. You must really consider this. So I have to treat 124 patients to prevent 1 bad outcome. But in this study, there were 5 out of 8 people who had some form of substantial improvement in their symptoms of devastating chronic pain. For example, beta blockers, or just things like atenolol or metoprolol, you have to give 53 people this drug to prevent 1 known fatal heart attack, and 190 people have to be treated daily for 4.8 years to prevent 1 death. I mean, these numbers are staggering. Again, if I go back to the methylene blue, 5 people with 1 injection, 1 dose, had improvement. Aspirin used to be given all the time to millions and millions of people for stroke prevention, and it was told to people that it prevents heart attacks. So you have to give 333 people aspirin in order to prevent 1 known fatal heart attack. But the number needed to harm, which is you want to document, well, how many people got hurt by this intervention, was 1 in 250 had a major bleeding event that potentially led them to the hospital. So imagine what has been recommended in a mainstream medicine as useful, and yet this methylene blue study was considered a failure. I think I made my point. This study shows that methylene blue relieves the development of osteoarthritis by upregulating very specific RNA expression. In rabbits with osteoarthritis, the injection of methylene blue downregulated a number of markers for inflammation, and therefore it was stated that methylene blue protects against osteoarthritis progression. The reduction of inflammation by decreasing a number of inflammatory cytokines led to significant improvement in pain and inflammation in this rabbit model. Here, riboflavin, which is a vitamin, and methylene blue on visceral pain and pain perception was evaluated. And it was shown that in mice, the methylene blue had significant analgesic effect, meaning pain relieving effect on visceral pain, which can be very, very significant, and the perception of pain. This study looked at methylene blue on a post-operative low back pain and the functional outcomes after people had open back surgery for their disc. It was a triple-blind randomized placebo-controlled trial, which is considered the best way of doing trials. And the conclusions were that a single dose of methylene blue that was given intraoperatively to coat the dura and the surrounding tissues like the facet joints and the muscles were very safe and had significant lower radicular pain, meaning nerve pain, and post-operative pain. The functional quality of life improved significantly 3 months after the operation in both groups. But the disability occurred more frequently in the control group than the methylene blue group. So there was no toxicity to this. So it improved after back surgery the outcomes and functional recovery. This was a large study that looked at intradiscal methylene blue injections for low back pain, and it showed that 40% of patients had a positive results and there were no complications. 40% of these patients claimed at least 30% pain relief. Methylene blue has also been studied in other surgeries that can be extremely painful. Anorectal surgery and lateral anal sphincterotomy. Surgeries around the anal sphincters can be extremely painful, and these studies show that methylene blue, even in such painful circumstance, has clinical benefits that are substantial. This is a study that looks at oral mucositis in cancer patients. So cancer patients, when they get chemotherapy with very toxic agents, particularly if they also get radiation, for example, in head and neck cancers, they can have horrific pain. And what happened here in this study was that methylene blue was given as a mouth rinse, and it showed pain relief and sustained pain relief over 3 weeks. Patient satisfaction was very high. It reduced the opiate requirements, so the patients had much less use of morphine, and this really improved the quality of life. I have a personal experience with this in my clinic with patients who have received radiation to the head and neck, and with one infusion sustained pain relief from previous ongoing pain. So in my office, in the use of methylene blue, I have seen some absolutely remarkable results. I think that the chronic pain and opiate use epidemic in the United States is just outrageous, and to be able to offer something that is non-toxic and helpful to people in many cases with immediate results is quite fantastic. Cases of Instant pain relief, I have definitely seen that with intravenous methylene blue in osteoarthritis, where patients came in with 10 out of 10 pain and within 10 minutes into the infusion reported complete pain relief. That doesn't happen to everyone. I have some patients who don't feel anything, but the mere fact that there is a substantial number of patients who have such significant clinical outcomes that are so fast, to me, provides enormous hope as a clinician. I have had cases of complete pain relief that lasted from 8 hours to over a week with one dose intravenously. There's been significant improvement of quality of life and mood. There has been improved pain relief when we combine the IV infusions with the capsules. So patients take the capsules daily in between infusions. One of the things that's been shown is that methylene blue in low doses will, over time, change DNA expression in mitochondria so that they then start producing greater energy. So what happens is that the effects are cumulative, and so when we stay with the methylene blue and continue the treatment, people over time have a significant increase in response rates. So the methylene blue capsules and weekly or biweekly intravenous infusion improve back pain and joint pain, in some cases up to 80%. The back pain relief also occurred with capsules alone, and I've had some cases of complete pain relief with no longer needing any type of opiates, with severe osteoarthritis of the spine and previous vertebral compression fractures, which is an outstanding result. I've had cases of reduction of opiate use by over 75% of baseline within 4 weeks after treating the methylene blue treatment. Some days not needing any pain medication, and the improvement continues as we're continuing treatment. There's also been significant reports of improved sleep due to less pain and enhancement of quality of life. So I definitely think that this is a tremendous treatment. I combine it with other things, peptides like GHK copper that have also significant pain relieving effects. I do think that this is a fantastic alternative for people. It clearly provides a pathway for people to come off of chronic opiates. If you would like more information about AM Medical, you can find us at ammedicalmd.com. We are located in Yelm, Washington, and you can follow us on Facebook and YouTube. Thank you very much for watching.